Hi, I'm Dr. Janssen. Welcome to our office. You know, it turns out lots of people don't know about chiropractic and lots of people don't know about their body and how it works. So I thought I'd go over a few things with you before I show you your findings and your x-rays and give you a little pep talk to let you know what I think is important. First of all, the way the body communicates with itself is the nervous system. And the nervous system is how the brain communicates with everything in the body, from the cells to the muscles to the organs. Everything has a to and from to the body. So that's a big communication network of the body. So when we work with chiropractic, we have a positive effect on the nervous system. Sometimes when we do adjustments, it reduces pain. Sometimes it makes the nervous system work better. So when I talk about chiropractic adjustments and chiropractic manipulation, a lot of people go, oh, I've got a fear factor. They think I'm going to crack their neck. And I can do that. And there's lots of different techniques that we use, but the most important thing is that we do or use the technique that works best for you and gets the best results. So when we come down to the safety of chiropractic, chiropractic is one of the safest treatment regimens out there. If you're thinking about an adverse reaction to chiropractic, the likelihood of that occurring is about 1 in 5 million. That's 1 in 5 million. That's safer than aspirin. So chiropractic is very safe. Now, most people come into the office and they have symptoms. And symptoms are their body's way of telling them that they have a problem. It doesn't tell them what the problem is. It's kind of like the check engine light on the car, or the oil light coming on the car. That tells you that there is a problem. It's not the problem. So what we have to do is, if you're watching this video, we've already determined that the likelihood is great that we're going to be able to help you. So what we want to do is we want to find out what the underlying issues are that create the pain that you have. So initially what we do is we start with some passive care. Passive care is where we're doing something to you. And most people have a muscle and a structural problem. We do adjustments for the structural problem, and we do some therapy, some passive therapy, which is usually interferential, which is electrical therapy. It doesn't shock you. We do interferential, that's a light therapy, which increases the blood flow through the muscles. And both of those are used to help reduce the pain. So we want to reduce the structural distortion. We want to reduce the muscle problems. And when we start treating you, we want to treat you frequently enough that we get a response and that we reduce the pain. So some people come in daily and some people come in 2 or 3 times a week. It all depends on the severity of the pain, the severity of the condition, and the chronicity of the condition. So after we do somewhere between 6 and 10 treatments on you, we do an evaluation. The evaluation tells us what your response has been, how you're coming along, and also allows you to tell us how you're coming along. So usually by that time, there's been an improvement in the symptoms. A lot of times a significant improvement. And so we come to a fork in the road. And the fork in the road is whether you go down one path where all you're doing is looking for symptom reduction, where you say, hey, doc, you did a great job. I'm feeling good. I'll call you when I need you again. Or you're a smart patient and you determine that the symptoms are just part of the issue, and so you want to work on the underlying condition, and so you do some rehabilitative care. And we're great at rehabilitative care. That's where we make the body work better. We make the body healthier. And during the rehabilitative care, what we do is we also give you some homework. The homework is exercises, stretching, posture tips, and we recommend that you do the homework, because if you do, it makes a difference, and if you don't, it also makes a difference, and it gets it so you get to come back in and see me at a sooner time. Now, at the end of the rehabilitation, where we got you all fixed up and you're feeling frisky, what happens is we get to a point where you decide whether or not you want to continue on with care. And the continuation of the care is a maintenance care. And maintenance care is kind of like going to the dentist. You go to the dentist, if you floss and brush your teeth and you do it on a regular basis, you still go to see the dentist, but the bill is cheap and you don't have to go very often. So what happens with us is some people on maintenance care come in once a month, and some people come in once a quarter. It depends on what they do, their active lifestyle, and etc. So Going to see you in a few minutes. Thanks for watching.